Hello everyone. Today we are going to discuss about biomedical waste management. The first we are going to see what is waste because our topic is biomedical waste management. So before knowing the management we should know what is waste. As we know that waste is something which is not put into a proper uses at a given time. It means anything if you are not using in it proper time the things will be waste only, right? So waste it can be three categories. One is solid, one is liquid, one is gaseous. So in the solid we have three more types: household waste, industrial waste and biomedical waste or hospital waste. So this is the introduction of waste. Okay, there are three types: solid, liquid and gaseous. Next we will see what is biomedical waste. First we have seen what is waste. The thing if you are not using it at proper time, it will be the waste product. So what is biomedical waste? Any waste which is generated during the diagnosis, treatment or immunization of human being or animal or in research activities pertaining thereto or in the production of testing of biological. So any waste which is comes from the hospital side, okay, like from the hospital if you are using anything for the treatment of the patient or giving immunization or vaccine or for the diagnosing or the finding out the what is the disease, okay, for that purpose if whatever you are using in the hospital, from that what are the waste is coming, that will call biomedical waste. You can see in the picture it may be like syringe, needle, blade, okay, it's everything, it's come under biomedical waste. So causes of this biomedical waste management is for improper packaging, segregation, treatment and disposal of biomedical waste. This is the causes why you need to manage this, because then only you can do it packaging properly, segregation of thing properly and treatment of disposal of biomedical waste. Next one is classification of biomedical waste. So there are total 9 categories. The first one is infectious waste, pathological waste, sharp waste, pharmaceutical waste, genotoxic waste, chemical waste, waste with high content of heavy metals, pressurized container and radioactive waste. So these are the types of biomedical waste. Now we are going to see in details one by one. The first one, infectious waste. Infectious waste suspected to contain pathogens like bacteria, virus, parasite or fungi in sufficient quantity to cause disease in susceptible host. So what are the infectious waste? If any products which contains pathogen, it may be bacteria, virus, okay, that much it has content that it can cause disease in the human body, that is infectious waste. So the categories include culture and stock of infectious agent from laboratory work, waste from surgery on the patient with infectious disease and infected animals from the laboratories. What are the infectious product we can see in the hospital? Next we have pathological waste, the second type. So it consists of a tissue, organ, body parts, human fetuses, animal carcasses, blood and body fluids. Okay, pathological means any human body part like any organ, any tissue, blood or human fetuses. Human fetuses means unborn baby. Okay, this all comes under pathological waste. Next we have sharp. Okay, sharp instruments or you can say sharp waste. These are the items that could cause cut or puncture wound. Okay, including क्या क्या आता है sharps like needles, scalpel or other blades, knives, infusion set, saws and broken glasses and nails. Okay, sharp instrument like from where we can get, there is a chance of getting prick or cut. Okay, that's everything comes under sharp waste. You can see in the picture. Next we have pharmaceutical waste. It includes expired, unused, split and contaminated medicine like any drugs, any vaccine, sera or any products which is expired. Okay, the date of expiry is gone, unused, not used, or it is contaminated. Next type is genotoxic waste. Genotoxic waste is highly hazardous and may have mutagenic, teratogenic, and carcinogenic. Okay, genotoxic means gene related waste which is more dangerous. Okay, and it can cause the this cancer. Okay, and it can cause this if the mother is infected or with this genotoxic waste, the baby also can affected. So these are the genotoxic waste. It raises seriously safety problems both inside hospital and after disposal and should be given special attention. It includes certain cytostatic drug, vomit, urine or feces from the patient treated with the cytostatic drug, chemical and radioactive materials. Means this genotoxic waste, no, you have to give more attention. Okay, because it is more dangerous than other waste. So it is not in the hospital, like where you are going to throw it or where we are going to do the management for it, in that area also you have to take care of it. Next we have chemical waste. So chemical, it consists of discarded solid, liquid and gaseous chemical. Chemical waste may be hazardous or non-hazardous. It considered to be the hazardous if it has at least of one of the following properties, like if it is toxic, if it is corrosive, if it is flammable, if it is reactive, or if it is genotoxic. Then only the chemical waste will be hazardous, means harmful. The next type is waste with high content of heavy metals. It represents a subcategory of hazardous chemical waste and it is usually highly toxic. Example is batteries, broken thermometer and blood pressure gauge. Okay, you can see in this picture, see these are the item. If it is in good condition we can use it, but if it is broken or if it is expired, then it will be waste and it is harmful if you are not putting in a proper place. Okay, the next one is pressurized container. Many type of gas are used in the healthcare and are often stored in the pressurized cylinder, cartridges and aerosol can, like you can see gas cylinder or oxygen cylinder. Most common gases used in the healthcare includes anesthetic gases, ethylene oxide, oxygen and compressed air. So if it is used, it is good. If it is above, like after expiry date got over, okay, or if any leakage, if anything, then it will be harmful. Next we have radioactive waste. It includes the X-ray, alpha and beta particles and gamma rays emitted by radioactive substance. Alpha particles are heavy, positively charged and include proton and neutrons, and they have low penetration power and are hazardous to the human mostly when inhaled or ingested. Okay, like in the X-ray, whatever ray they are using to do the this find out, like any fracture, if anything happened to the patient, to find out that they'll do the X-ray. Okay, there are so many tests. In this they'll use certain ray. Okay, so that also harmful. Next we are going to study about the sources of biomedical waste, like from where this biomedical waste will come. The first one is hospital or healthcare center, from that this waste will be coming. Second one is blood bank, and third one is biotechnological institution, means where they are going to do all the research activities and all. No, from there also biomedical waste will come. Okay, sources means from where this waste is we are getting. Okay, hospital, blood bank and biotechnological institution. You can see. Then one more thing, household waste also is there. Okay, it is not coming under biomedical waste. Household means in the, like in our house normally whatever waste is coming. Okay, that is household waste. There is a industrial and educational institution and research center also. Okay, see in industry also, like education institute, there from there also will get some waste products. These are also generated biomedical waste in substantial quantities. The type of waste generated from an animal house is typically animal tissue, okay, organ, body parts, carcasses, body fluids, bloods, okay, etc. of experimental animals. Like in the research center, no, if they are doing any test on any animal, okay, after doing the test, that their body part, okay, anything, if it is coming, that's also waste only. From blood bank also that waste is available. The blood banks and laboratories generated most of the categories of biomedical waste. Healthcare establishments means hospital is the main source of biomedical waste. Next is effect of biomedical waste. The improper management of biomedical waste causes serious environmental pollution. So if this waste product is not managed properly, or if it is not dumping properly, it can cause environmental problem like air pollution, water pollution and the land pollution. So in the air pollution can be caused in both indoors and outdoors. Biomedical waste that generated air pollution of the three types. One is biological, chemical and radioactive. Indoor air pollution means hospital acquired infection or nosocomial infection. So means if after, see, if you went with some disease to the hospital for any other disease, but after going there you got new disease that occurred because you are staying in the hospital, because of hospital treatment or their these safety things, or their if they're not following the safety properly, because of that reason you got some disease, means it is called hospital acquired infection. After going hospital only you got this disease, okay, or we call nosocomial infection. Indoor air pollution can cause due to poor ventilation. The paint they are using carpet, furniture, equipments and used in the room. Use of chemical disinfection and fumigates. So you can see this, if how they are throwing this waste and how it is causing the damage to the everyone, all the animals, if it is not put properly. Land pollution. Open dumping of biomedical waste is the greatest cause of land pollution. Means simply if you are taking all the biomedical waste from the hospital and going and throwing somewhere, so it will be damaged for the land, that area, that land will be polluted. Yes. So soil pollution from biomedical waste is caused due to infectious waste and discarded medicine and chemicals. Heavy metals such as cadmium, lead, mercury, etc., which are present in the waste will get absorbed by the plants and can then enter to the food chain. So what happen if you are putting in anywhere in the dirt, it will be absorbed by the land or plant, okay. After that again it will come to our body only through the food chain. So now we are going to see the method of disposal of biomedical waste and their segregation. So in the waste category, there are some category, there are types of waste and there is a treatment, okay, which category will treated or how they will manage, okay, like which waste will be managed by which procedure. So category 1 we have human anatomical waste, that is human tissue, organs, body parts, that will be incineration or deep burial. Next one is category 2, that is animal waste, okay, all animal waste, it will be also same procedure of disposable we are going to use. Category 3 we have microbiology and biotechnology waste, okay, that we are going to use autoclaving or microwaving or incineration. Category 4, that is waste sharp like needle, syringe, scalpel, blade, that what we are going to do, the method of disposable is disinfecting, chemical treatment or autoclaving or microwaving or mutilation and shredding. The category 5 is discarded medicine and cytotoxic drug. What is the disposable method? Incineration and destruction of drug disposable in secure landfill. Secure landfill like where that there is no people staying nearby. Okay, in that type of area they have to throw it. Category 6 like solid waste. Example, items contaminated with body fluids including cottons, dressing, solid plaster cast, okay, line, bedding and other materials. The method of disposable is incineration, autoclaving and microwaving. The next category is solid waste. So waste generated from the disposable item other than the waste sub such as tubing, catheter and intravenous set. How they are going to disposable? Disinfected by the chemical treatment, autoclaving, microwaving and mutilation and shredding. Next we have category number 8, that is liquid waste. Like this is the process of segregation. Okay, in that waste generated. So in the liquid waste generated from the laboratory and washing, cleaning, housekeeping and disinfecting activities, and it is disinfected by the chemical treatment and discharged into drains. Category 9 is incineration ash, that is ash from the incineration of any biomedical waste, and it is disposable in the municipal landfill. Category number 10 is chemical waste. The chemical used in the production of biological, chemical used in the disinfecting and as insecticides, and chemical treatment and the discharge into the drain for the liquid and the secure landfill for solid. Next is steps in the management of biomedical waste. The first one is survey of waste generated. Means first we have to do a survey about the waste generated. Second one is segregation of hospital waste. In the hospital we have to segregate, means separate the items like sharp instruments separately, then this plastic waste separately, then contaminated waste separately, like this. Next step is collection and categorization of waste. That after segregation, now we'll collect the waste and give the different categories, that what we have studied till now, category 1 to category 10. Next is storage of waste and not beyond 48 hours. Means once you have done the collection and categorization, what we will do, we have to store the waste, but we should not keep it more than 48 hours. After the storage, transportation of waste, we will transport it to the treat and we will do the treatment of the waste, means proper management according to the category. Next is color coding for the segregation of biomedical waste. So in the hospital, no, there will be different color code in which color of like bag you can say, or box or container, which waste will go. Like for yellow color, all the human and animal anatomical waste will go, microbiological waste, solid, cotton, dressing, linen and bedding. For the red, tubing, catheter and IV. Blue or white, all sharp instrument. Black, discarded medicine and cytotoxic drugs. But if you sometimes no, depending on the hospital policy, there is a little changes in the color. Like some people they'll use only blue or white for sharp instruments, and blue they'll use for plastic items. Okay, some hospital they'll use green for that normal general waste. Okay, so this is the basic. Yellow for the human and animal anatomical waste, red for the tubing and catheters, blue and white for the sharp instruments and black for the discarded medicine. So like this container you can notice in the hospital. So but in the private hospital, different hospital, there is some modification of this color code. Okay, so with this we have completed this topic, biomedical waste management. Thank you everyone.